Hey everyone. So, if you're getting ready to be a phlebotomist, you already know just how critical your technique is. But there's a whole other layer to it, and that's how a patient's own nervous and endocrine systems can impact every single draw you do. Today, we're going to connect those dots from the brain all the way to the vein. And trust me, getting this right isn't just about passing your exam, it's about keeping your patient safe and making sure your results are spot on.
So here's our game plan for today. We'll kick things off with that brain-to-vein connection. Then we'll dive into how to screen for fainting, what we call syncope. After that, we'll get into the nitty-gritty of the draw itself, things like pain and positioning. Then we're going to switch gears and talk about the special rules for hormone tests. And to wrap it all up, we'll pull everything together with a review to make sure you're totally ready for your exam. Let's dive right in.
All right, first up, from brain to vein. Now, I know you probably don't think of yourself as a brain expert, but honestly, understanding the basics of the nervous system is a non-negotiable part of this job. Let's break down exactly why that is.
So why does all this brain stuff matter when you're just drawing blood? Well, it's because your patient's nervous system is sitting right there in the chair with them. Their anxiety, how their body processes pain, their natural reflexes, all of this has a direct impact on their safety and, believe it or not, on the quality of the sample you're trying to collect.
Okay, so let's split the nervous system into the two parts you really need to know. First up is the autonomic system. Just think automatic. This is all the involuntary stuff. A racing heart, sweating, feeling faint. Your patient can't control it, but you have to be ready for it. The other side is the somatic system. This controls voluntary movements. This is the part we can influence with clear instructions, like please make a loose fist or try to keep your arm still for me.
Now, what's really cool is how this table puts it all into perspective for us. The autonomic system is running the show behind the scenes, controlling things like the patient's blood pressure. The somatic system, on the other hand, is all about cooperation. We need the patient to work with us to keep their arm stable so we can get a good, clean sample. So remember this, we coach the somatic, but we have to anticipate and manage the autonomic. Okay, everybody lean in for this one. This is a huge, huge tip for your certification exam. You will absolutely see questions that ask you to compare the effects of the autonomic and somatic systems during a blood draw. You've got to know the difference, inside and out.
So, speaking of that autonomic system, that brings us perfectly into our next section, screening for syncope. This is where we take what we just learned and apply it to prevent one of the scariest and most common things that can happen in our chair. A patient fainting. So what exactly is vasovagal syncope? Well, it's that powerful, involuntary autonomic response we were just talking about. For some people, the anxiety from seeing a needle is enough to trigger a sudden drop in their heart rate and blood pressure, and they pass out. Your number one job as a phlebotomist is to spot the warning signs before that happens.
These are the signs. You need to burn these into your memory right now. If your patient's face suddenly goes pale, if they start sweating or yawning out of nowhere, or if they tell you they feel dizzy or sick to their stomach, that is your red alert. That's your signal to act, and to act immediately, no hesitation.
And if you see any of those signs, this three-step response is mandatory. Step 1, stop what you're doing. Tourniquet off, needle out, safety engaged, immediately. Step 2, position the patient to get blood flowing back to their brain. That means getting their head down and their legs up. And step 3, monitor them closely. Check their breathing, their pulse, and document everything that happened. This isn't a suggestion, it's a critical safety protocol.
All right, moving on to section 3, the draw itself. Now we're going to focus on pain and positioning. This is where we combine our technical skills with our knowledge of the nervous system to protect both our patient and our sample. Okay, let's talk about a super common mistake, asking the patient to pump their fist. You know, it seems like it helps, it makes those veins pop. But here's the problem, that aggressive clenching can actually mess up the lab results. It can falsely increase potassium levels, which is a big deal. This is a classic preanalytical error. The correct instruction is so much simpler. Just ask them to keep their hand open and relaxed. Here's a really great little memory trick to help tie all these systems together. Just remember, skin shows, nerves control, muscles move, bones protect. The skin shows you where to go, the nerves control the patient's reaction, the muscles are what move the arm, and the bones protect everything underneath. Simple, right? So this right here, think of this as your roadmap to a safe and successful draw. Notice how it weaves in everything we've talked about. It starts with screening for that fainting risk.
Then you prepare your space, just in case. You position the patient correctly, coach them on their breathing and keeping a relaxed hand. And then the most important part, you observe them the entire time so you can act the second you see a warning sign. Following these steps every single time is what separates a good phlebotomist from a great one.
Okay, let's make a big shift here and move into our fourth section, hormones. When we're dealing with the endocrine system, what you do before that sample ever gets to the lab is just as important, if not more important, than the analysis itself. This is all about preanalytical precision, and a tiny mistake here can make the test completely worthless.
So let's look at a few of these glands. With the pituitary gland, hormones like ACTH have a daily rhythm, which is why cortisol tests absolutely have to be drawn first thing in the morning. For the thyroid, you have to ask your patient if they take biotin supplements because that can seriously interfere with the results. And for the parathyroids, this is an absolute do not pass go rule. You can never ever draw a sample for calcium or PTH in a lavender top tube, period.
And that same level of detail applies across the board. For the adrenals, we've got that timed morning draw for cortisol. But did you know that even the patient's posture can affect aldosterone levels? For the pancreas, glucose tests need those special gray top tubes to stop the blood cells from eating up all the sugar before it gets to the lab. And for the gonads, again, timing is everything. Testosterone, for example, is highest in the morning.
Let's just put a giant red flag on this because it is that important. The additive in those lavender top tubes is called EDTA. Its whole job is to grab onto calcium. So you can imagine if you draw a calcium test in that tube, the EDTA is going to snatch it all up, and the lab result will be falsely, ridiculously low. It's completely useless. You have to follow the tube requirements exactly, no exceptions. And here you can see exactly why all these little rules are so critical. You can't diagnose Addison's disease without that perfect 8 a.m. cortisol draw. You can't properly run a glucose tolerance test without writing the exact time on every single tube. Your actions aren't just about technique. You are a crucial part of the entire diagnostic process. Okay, let's bring it all home with our final section, your exam-ready review. This is where we're going to boil everything down into the key actions that turn all this theory into safer practice for you and better, more accurate results for your patients.
Think of this slide as your ultimate pre-draw checklist. For the nervous system, you're always going to screen for fainting, position for safety, coach a relaxed hand, and act at the first warning sign. For the endocrine system, you're always going to verify the timing, confirm patient prep like fasting, use the correct tube, and document everything. If you can nail these 8 actions, every time, you are well on your way to being an exceptional phlebotomist.
And here's one last pro tip for you, something to help you think beyond just the draw itself. For endocrine tests, try to think in pairs. There's the driver hormone from the pituitary and the target hormone it controls. So TSH drives T4, ACTH drives cortisol. Understanding that relationship helps you see why collecting both samples correctly is so incredibly vital for getting the full diagnostic picture.
So, as we've seen, this is about so much more than just memorizing rules for an exam. It's about understanding the why behind every single thing you do. It's what separates a technician from a true healthcare professional. It's how you protect your patients, and it's how you guarantee the integrity of every single specimen you touch. You've totally got this. You are ready.